So you get a prescription from the doctor. But do you keep taking it as the doctor ordered? Studies show that half of all patients don't continue taking their medicine. For some conditions, the number of medication dropouts is even higher. About 24 million people worldwide have schizophrenia, a debilitating mental illness. Almost 3 out of 4 people with schizophrenia stop taking their medicine within 18 months. Schizophrenia drugs go a long way towards treating these symptoms, but they have side effects. Among them are unwanted weight gain, increased risks of diabetes and heart disease, as well as involuntary muscle movements. Patients with other serious illnesses also stop taking their prescribed drugs because they can't stand the side effects. This includes people taking medicine for cancer. About 650,000 cancer patients undergo chemotherapy each year in the United States alone. Some experience nausea, vomiting, and other side effects that make them wonder whether to continue treatment. Working at Pfizer, the world's largest drug maker, Dr. John Lowe conducted research that led to drugs that ease the side effects in patients with cancer and schizophrenia. The American Chemical Society recognized this important work and named Lowe the recipient of the 2011 ACS Award in Industrial Chemistry. For schizophrenia, cancer, and other diseases, patients need balance, as Dr. Lowe explains.
The balance between side effects and efficacy is different for every antipsychotic drug. And so every physician has to work with their patient in order to get the right balance for each patient. It's important to remember that the first antipsychotic drugs were actually developed as antihistamines, and their sedative properties were thought possibly to be useful for the treatment of mental disease. And it was only serendipitously discovered that the drugs were very effective at treating the positive symptoms of schizophrenia. This miraculously helped many, many patients. But eventually patients began to discover side effects, motor coordination, shaking, Parkinsonism. All of these go under the name of extrapyramidal symptoms, or EPS. This in itself wouldn't be so bad, but it leads to an irreversible syndrome called tardive dyskinesia, in which the patient is permanently disfigured. And while the patient himself or herself may not be that distressed, the family is particularly distressed to see the patient permanently disfigured this way.
Patients with tardive dyskinesia may grimace, smack their lips, or blink their eyes over and over. Lowe and his colleagues spent almost 14 years searching for a better schizophrenia drug, one that treats the positive and negative symptoms, but is less likely to lead to tardive dyskinesia. That drug is one of the so-called second-generation schizophrenia medicines. It is ziprasidone, otherwise known as Geodon. This drug behind the ACS prize helps more than 1 million patients each year around the world. As Dr. Lowe explains, patients on Geodon may have fewer problems with weight gain and other side effects.
So in addition to alleviating the side effects of the first-generation drugs, it turned out that ziprasidone has one additional advantage, and that is that the histamine blockade of the early drugs, which was their original activity, is actually much weaker in ziprasidone. And that histamine activity unfortunately led to another round of side effects in the drugs, which involves weight gain, hyperglycemia, triglyceride level increases, all of which increase the risk of diabetes.
In another research project, Lowe worked on substance P, a chemical messenger involved in the sensation of pain. It may sound like mysterious stuff, but chances are that you've felt its effects.
Millions of people have had contact with substance P without realizing it, because substances such as chili peppers and wasabi and sushi can release substance P and cause an inflammatory response.
Lowe's research led to the discovery of a drug that blocks the effects of substance P. Called aprepitant, or Emend, it relieves nausea and vomiting in patients in cancer chemotherapy.
Cancer chemotherapy drugs are very effective in treating cancer. However, they also induce serious side effects, among which is nausea and vomiting, which is called emesis. These drugs cause nausea and vomiting so severe that many patients are not able to complete their course of therapy.
Fortunately, Lowe's award-winning work eases medication side effects for millions of people around the world.